Welcome. I'm Ronnie Burke, a clinical social worker, and the topic is, as you've seen, sexuality and disabilities. And now what I'd like to do is for you to start thinking about the uncomfortable silence about this subject. Many people don't want to talk about it. Many people think sexuality and disabilities don't go together. Okay? So when I say to you, think about sexuality, try and think about what words come into mind. What is happening in your mind when you start talking about sexuality, not disabilities, just sexuality. It's not exactly an easy or comfortable topic to talk about, right? So let's see what words come into mind when you were thinking about it, right? There are many other words that come into mind, like homosexuality or pregnancy or sexuality itself and so on. Okay, so now what I would like to do is see how you feel about physical disabilities. Any words coming out on disability, on physical disability? Think about that one, okay? Let's see. I'm gonna increase the slides. Let's see me and see slides. I think that's gonna be better, but it doesn't seem to be working. Okay, there we go, and I'm gonna get rid of myself. Right, so now if you look at that, there's a lot of physical disabilities. Okay, you won't be seeing me for a while. I think it's important to get through the slideshows as well, and I will come back once in a while. So physical disability, here we're talking about, well, the association can be illnesses, respiratory problems, wheelchairs. I don't know, I think it's basically an issue which one needs to think about, which words you can associate. But here, if you do sexuality and physical disability, think of a few words, throw in a few words. I don't know, how do you feel about sexuality and disability? Any ideas? I know that you're professionals, but it's also important that we can check on what we think about sexuality, okay? Taboo, I would say. No sex involved, maybe. Unattractive, abstinence. All these different words can possibly affect your whole outlook and impact on the idea of sex therapy and physical disability. Okay. So, right, what I'd like to do now, all's good, is if we're talking about a physical disability, it is described into two categories. Obviously, a hereditary factor, where a person has been born with a physical disability or developed one due to inherited genetical problems. There's also the acquired one, and the acquired one is also a lot of work that needs to be done, because an acquired physical disability could be due to an accident, infection, or disease, which is something that it wasn't used to before, and it's a whole new lifestyle change. But I'd like to just because we are dealing with the subject, and it's important that we define what sexuality is by the World Health Organization. This is from 2008, by the way. Now, have a look at this definition. You all there? You okay? Here we go. Sexuality is a central aspect of being human throughout life. It imposes sex, gender identities and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. Sexuality is experienced and expressed in thoughts, fantasies, desires, beliefs, attitudes, values, behaviors, practices, roles, and relationships. While sexuality can include all of these dimensions, not all of them are always experienced or expressed, as you know. But sexuality is influenced by the interaction of biological, psychological, social, economical, political, cultural, legal, historical, religious, and spiritual factors. Wow, huge interpretation. So imagine, now we're going to add on to that also sexuality and disabilities. So just imagine what's going through everyone's mind when they think about this topic. So sexuality and disability tends to be a taboo, which no one really does want to talk about. And it does refer to sexual behavior and practices of people with disabilities. By the way, PWD is going to be the term. If I say that, you know it means people with disabilities, okay? People with disabilities have a range of sexual desires and differ in many ways they choose to express their sexualities. Commonly, PWD lack comprehensive sex education. Now, if we talk about lacking of sex education, it's because society believes that maybe they don't need education because of the disability and that sex doesn't exist, okay? We need to take that into consideration, okay? Okay, a lack of rights for many people with disabilities and privileges that will enable them to have intimacy and relationships, because they aren't seen as sexual people. They are seen as just objects and asexual. For physical disabilities that change a person's sexual functioning, such as spinal cord injuries and others, there are methods which are needed. A person may enjoy sex with the help of sex toys and physical aids, such as bed modifications, which we are going to be dealing with later and showing you the whole idea of how it is possible. Okay. Another area is that you need to know that people with disabilities have rights, which is obvious, but not obvious to everyone. The right to sexual expression, the right to privacy, the right to be informed about social support services, the right to choose one's marital status, the right to have and have or not have children. Many people think, oh my goodness, no children involved here because of the disability, which is just a myth, okay? The right to make one's own decisions and develop one's own full potential. So let's break that stereotype, because it's important, very important as professionals and people generally to see that people with disabilities have rights and have sexual rights too. And it's no good desexualizing people with disabilities. For example, people have this idea that men and women with disabilities don't even need sex because they're asexual. They have ideas that people don't have real sex, or they're not sexually attractive. They don't need sex. They can't be spontaneous because of the physical disabilities. People with disabilities do not even need sex. I mean, is that true? Well, let's see how you feel about that. Start thinking about all these questions while we go through today's webinar. Men and women with disabilities should not have children. We spoke about that. Boys and girls with disability don't even need sex education. How true is that? Not true. Okay. You cannot hear me? So when we're talking about it, you cannot hear the presentator. Sound. Okay. Okay, so, but you can you hear me? Basically, what I'm saying here is that it's important for me, it's important for you to realize that, okay, great. If you can hear me, I'm going to carry on, okay? It's very important for you to realize, and I love this word, and this is our motto, our keyword, pleasurable. Pleasure-able, okay? Can you see it? Pleasure-able. We are able and it's pleasurable, okay? And there's far too more than sex and just sexual intercourse. Great, I'm happy you can all hear me right now. That makes me feel a lot better instead of just seeing slides. I know you can't see me, but you will see me later, hopefully. Okay, so when we're talking about that, we have to take into consideration what intimacy is all. And Stephanie Dorwick defines intimacy as a closeness to yourself in times of solitude or closeness to others in moments of sharing and connecting. Reflects your inner world as almost nothing else does. Intimacy begins from the inside. It begins from your own self, and your own self begins with who you are and not about the disability. Okay, it is important that physical disabilities and living with physical disabilities is important to know that there is hope, okay, because some people, whether they've been born with it or accidents happen later, there is hope, and that it is possible to have a sexual life. But basically what's happening is that the partner have to be very, very open about it, okay? Very open about their sexual issues and sexual life. And a lot of common issues with sexuality and physical disabilities are as follows. There's a lot of sensation, okay? But here, one can discover new erogenous zones, areas sensitive to touch if the genitals have not been affected. Okay, I hope I'm not losing sound again. I'm going to keep going, though. Lack of muscle strength, muscle spasms may increase or decrease pleasure. Try to find positions that promote or inhibit spasms accordingly. The inability to achieve or sustain an erection, this is a common one. Can use toys or other ones. There are substitutes, okay? Oh, thank you for that. I'm going to keep going, okay? Thank you. Right. So basically, we're going to move on to a few more common issues. There could be issues of urinary or bowel income. Here, share with the partner the possibility of an accident, because that could happen during the act of sex. And if the partner does feel comfortable about it, it's okay. Fatigue. Find positions that resume less physical exertion. Joint pains as well. Positions that don't put pressure on. Back pains, premature ejaculation. Share with a partner to avoid misunderstandings, and talk to a therapist. Talk about it, because talking about it can help ejaculations. blindness or visual impairment. We're going to be dealing with that later. Emphasize body explorations through touch, sound, smell, and imagination. Right. Okay. How are we doing there, everyone? Can you hear me? I'm just going to see. There I am. All good? Okay. Hopefully you can still hear me. I'm sorry about if there's any. Yes, great. I'm glad you can. Okay. So, if you look at all these different physical abilities, but I focus, just, give it a touch. There's paraplegic, there's quadriplegic, there's arthritis, amputees, which is very common, back injuries, there's erectile dysfunctions, hip replacements, strokes, hearing loss, all these multiple sclerosis, CP, cerebral palsy as well. Injury are all physical disabilities. Well, sexual activity into all these different things. So basically the idea is to explain that it is possible. And let's, for example, for individuals living with a spinal cord injury, discussing concerns about sexual mobility can sometimes be a difficult topic. Okay, that's where we come into. We can talk about it and deal with the concerning, but for a man, the higher the injury to the spine, the better chances of being able to have erections and ejaculations. For a woman, sometimes to have an orgasm is very difficult. Feels in other parts of the bodies. She'll have sensations in other parts of the body, so it is possible. And there are many concerns of anxieties having sex. Okay, these are the issues that us as sex therapists do deal with it, because once you speak about it and feel less in the positive sexual life, even with a spinal cord injury. Okay, arthritis. Knee pain or arthritis, whether in the hands, wrists, knees, or feet, can often prove an obstacle to sex and intimacy. Okay, but you can enjoy this. This is a good one. You may find that sex with arthritis can best be enjoyed when you plan at a time when you permanently feel your best. Okay, that's important, right? So invite your partner to join you for a warm bath or shower to loosen the joints and heighten arousal. Set the mood and scented candles and soft music. Then ask for a gentle massage to help relax your body. These things do help with arthritis, by the way. It seems simple and easy, but it does, and it's been proven. Okay, hold on, it's not jumping. Let's move on. Yeah, back injury as well. Dealing with back pain in sex is like dealing with it everywhere. Difficult one, but it can alleviate it if done gently. CP as well. Cerebral palsy. Muscle rigidity, muscle weaknesses, fatigue can impact the sex life, but it is important that it can be incorporated sexual acts as well with CP. This is a good one. After stroke, the myth is that people don't seem to have a good sex life after having a stroke. But many couples are worried about reassuring sex after a stroke. But it will increase the risk of another stroke, but that's not true. The reoccurrence of another stroke because of sexual activity is unlikely. Sex is usually good for physical and mental and well-being stroke survivors and their partners. Okay, so that's important to know. Right. All difference of having to integrate to sexual activity, but you have to be positive. It's more about having a positive approach to the leg loss and working on that. Wounded soldiers as well. Although way before, part of the therapy is dealing with how I'm going to become sexually active with being a wounded soldier or being an amputee. Erectile dysfunction, this is very common. It's caused by so many factors. It's very, very common in sexual therapy, by the way, with men, which is from heart disease, aging, and so on. Erectile dysfunction okay, for example, there are other ways, strap-ons, which can be replaced so they worrying about it, because the worry causes the penis not to work. Joint and pains, knee or injury, multiple sclerosis. These are all the different issues which I'm not going to go too much into detail with, but there are ways of enjoying a sexual life and incorporating it with all these different physical disabilities. Paraplegic as well. Loss of movement and feeling in the legs, possibly also accommodation by the same in the genital. It doesn't have to be the end of a sex life, by the way. For men and women, this can be overcome with patience, consideration, love, and the right devices. We'll be dealing with these devices. Let me move on and showing you what can be done and the difference with later in order to do the same with quadriplegic. Okay. Wheelchair. Okay, this is also can be use your imagination here. It's a very, very good way of incorporating your sexual life and being very creative. Wheelchairs can be incorporated kinkily, and you can and your partner can enjoy a whole new avenues of intimacy. When we're dealing with this, what we need to do, think about one can enjoy sex with a disability. So, in other words, there are some ways sexual aids that can be designed to enhance sexual mobility. So, if you have a look at the there's so many different ways. I just chose a few. There's strap-ons. There's the intimate rider, which you're going to be seeing in a minute. There's a sexual positioning sling or swing. There's a sex door position, which you can see over there. These are the different ways that enable enjoyment in sex and make it a lot easier and practical. Okay. If you see this original, this is known as the intimate rider. Okay, now this is very, very popular and invented many years ago. It has been helping couples overcome physical challenges and disabilities. It's fantastic, in fact. The intimate rider's patented technology allows one to achieve a broader range of motion with minimal effort, allowing the person with disability and partner to unleash intimacy in a way that was never possible before. So this eliminates the stigma that's impossible when you've got a disability and makes people just flow have a decent sex. It's comfortable, easy to use, and stores discreetly away, and there's no right or wrong way to use it. Okay. The device will balance and support that will allow one to share more intimate and stress-free moments and positions. These devices also allow the freedom of movement that will improve mobility and positioning, as well as satisfying the partner. Partner satisfaction is so important. Allowing the person with the disability to provide the motion, allow to discover new positions and create angles, also being creative, enhance sexual performance and enjoyment, and strengthen the relationship. A happy, healthy sexual. Okay, I just wanted to know how you doing there. You can hear me still as we move on. Great. Okay, so basically, the next element that I'd like to deal with is sensory disability. These are visual impairments and hearing loss. Okay, so basically, when we're talking about that, people seem to think, think about it. No, is really a sexual being because they are just here. Talking about visual impairments, VI, and intimacy. A visual impairment, which is usually cues to, they are erotically stimulated by touch, taste, aroma, pleasure, pain, and intuition. This is something which seems to be obvious, but spending quality time with being intimate is valid for the visual impaired, as they require more intense physical and exploration. It may be misunderstood. It's quite interesting. It may be misunderstood by the sighted world as clingy and needy. But if they're not properly stimulated, it may cause depression and withdrawal, where we need to get involved there, okay? Because the change in the frequency of affection upsets the internal of security. No different. Visually impaired people can feel a partner's response to touch, can see accuracy which stimulates a partner, and the points of origination. For example, feeling where the wetness of the vagina or anus originates helps us initially identify, target exact areas for maximum. Visually also arousal by mental and emotional signals transmitted by the partner. Okay. Added that one in. There was the World Hearing Day. I don't know if you all are aware of that, as or professionals. Yesterday, well, as social workers, it's very important to know that was the World Hearing Day, and their motto was, don't let hearing limit you. And I added annual sexuality. Don't let it limit your sexuality too. It will be interesting to see whether the topic they actually do deal with sexuality as I've added to a sign language video, which you can apparently link on and see. This is where there's a bit of a dilemma, because the actual video that I did put on is British Sign Language, not American, okay? But it is quite common in terms of how they see how they can express sexuality and sex and all the different words, which is very, as you can see, this is sex, this is the sign in sign language, okay? Now, understand sign language can be very useful for anyone who works or actually interacts with it. I know for you and me, and it's pretty difficult because we don't know sign language to interact and understand. But the goals are actually to try and understand where it comes from, and sex is a major part. It is a major part of sign language, and it is important to learn these. For sex therapists, at least, need to understand these terms as well, with special needs and with people with disabilities. The goals of communication go well beyond sexuality, by the way. Without the means to discuss sexuality in a precise and insightful manner, young people, deaf people, may not have the tools to either share sex or communicate appropriate about it. It becomes maybe they might be misunderstood and inappropriate behavior. But here's the challenge, okay? Many of the hand movements used to communicate sexual and are similar, requiring greater fluency than some people have. What does it mean? Basically, like we say, the American Sign, the British Sign Language, all these are similar, and it can be confusing. We tend to speak of sex in euphemisms or with slang terms. Yeah, this is the problem. And often don't even know the proper terms to describe an orgasm, ejaculation, oral sex, etc. Have a look at that video and you'll see what I mean. The discomfort many people have with sexuality is intensified when communicating in sign language, particularly since many of the hand gestures used are very graphic. Okay, you saw this one. Look at this one. Okay, pretty graphic, but it's the only way they can actually basically, get to explain what they really need. All right, so that's your sign language. All right, hang on. Right, so now at the moment, I've tried to deal with all the different types of disabilities at the moment. And now we're going to go into models, okay, models as sex therapists, how we're going to do sexuality and disability. The role of a therapist, role of a sex therapist. You're right, I thought I'd put my face in a little bit whilst I say hello, and then I'll disappear again. Sex therapy sessions are usually address the underlying emotional issues that may be impacting an individual's approach to and feelings about sex and the disability. So when you're dealing with partners with disabilities and you sit in front of them as a sex therapist, you actually, the disability disappears, and you find, which we'll try and give a few examples later, that the disability doesn't become an issue, it becomes more personal issues, daily tasks in the house, that these things are for like normal couple therapy, basically. The actual disability becomes less a part of it because it's been accepted as a couple. The beginning process is a lot more difficult. But while sex therapy is sometimes offered as a form of couples therapy, it's typically offered to individuals as well, as a tool to help them overcome inhibitions associated with their sex life and to incorporate it successfully into their sex life and the new adapted sex life. Oh, hold on, sorry. I'm going to move on there. Okay, so sex therapy may also include the following elements. Experimentation. What does this mean? That couples with disabilities may need to try different activities, such as role-playing or using sex toys to increase their desire. Other couples may need to adjust their sexual routine or positions, may use all those different aids that we saw earlier as a result of the disability, adapting to these new changes. Education. Sometimes clients are not even, this was a good one, because basically we spoke about asexualization or desexualization, that basically people didn't even bother to think that they could be educated sexually. So desexualization, people with disabilities, consequently, they may not even be aware of the anatomy and how the body functions during sexual activity. Consequently, when they start developing a relationship, there's a lot of sexual education that needs to be done before even going into the whole area of their relationship itself. They might also suggest the client to mirror to learn more about their body. Okay. Another element which is so important in sex therapy, especially if couples, and I believe most of the people here are couple counselors or dealing with counselors as well, is a technique called sensate focus. Okay, this is mainly used for couple, but it can be used for individuals with this, which is known as a self-sensate focus. This technique is mainly used for couples and designed to build trust and intimacy while reducing anxiety. It can, however, be used on the self, like I said before, self-sensate focus, in order to rediscover sexual satisfaction within the self, rediscovering erotic elements of the body, and hence practice what they want or need sexually or emotionally from a partner in a future relationship. The couples here progress into 3 stages, starting with non-sexual touching, progressing to genital touching, and usually ending with penetration. Okay, so I've adapted this. You'll see later I've adapted this with disabilities as well. However, it is so important to realize that there is more to sex than just sexual intercourse, and this is the motto. Communication strategies. Clients may practice asking what they want or need sexually or emotionally in a relationship, especially if there's a disability involved. Okay, let's see. There's a lot of issues that come up with in sex therapy with disabilities. Like any other relationship, there is the depression. Depression means having to deal with the disability itself. But from depression comes acceptance. Once it's accepted, then if it's in a couple relationship, then they explore ways of enjoying their relationship instead of focusing on the depression, how that affects their relationship. Anxiety and phobias could be involved, anger management, anger at the disability and not having to deal with it. This is where a lot of therapy does come. It's general therapy as well as sex therapy, when the anger of maybe not feeling that they have a satisfying sex life, which isn't true. Stress management, alcohol and substance use could be the case of many people trying to deal with their disabilities, but this is usually when they're not coupled up with partners. Okay, low self-esteem. I have a client with CP. She's now recently married, I think about 4 months ago. And one of the things that came up in therapy was not only the issue to try and have a sexual relationship and have a child, but the other thing was it came up that she felt that she was not, had a very low self-esteem and not pretty, and the way she walked was ugly, and it was a lot of work had to be done on trying to accept the disability and working through it, because the new husband didn't even see it through. He said, oh, she's gorgeous, and didn't see how, and it was actually shocked. She lowered her self-esteem. So a lot of the work can be, other than the sexuality, can also be a lot of work dealing with the couples itself. Domestic violence or abuse. Well, I mean, this could be a major case if there's a lot of frustration involved. But stress-related problems, it all depends. It happens at the beginning of relationships as well, because it's trying to accept the situation. Usually, when clients are not in a relationship, people become pretty violent and angry, and it becomes out of anger management. And anger management is the area that needs to be dealt with strongly. Relationship and couple-related problems. This is where people, it's just like normal couples. I said that before and previously, and many couples that are sit together and there are disabilities involved, until it gets round to sexual elements, it's quite absolutely amazing to see that it's the little things that become the big things, and the actual disability gets disappeared. You know, it doesn't even be seen. It isn't even noticed in the therapy. So the concerns relating to physical or emotional well-being can be, for example, the client or the person with the disability, okay, maybe, well, this is if they haven't got a partner, maybe concerned about never finding a partner. Maybe the disability for them is making them feeling not attractive, or that, you know, no ways they'll find someone to partner with. Again, this I saw as make they don't feel attractive. Okay, some of the clients with disabilities feel that they are concerned that the partner may think they're totally ugly, which isn't definitely not the case. There may be a lack of confidence about their sexual abilities or performance, and this is where we become involved and try and encourage sexual abilities, especially when couples are developing a relationship. And working on how their concerns about their body moves or works. This is where all those different sexual aids come into concern, and both partners can enjoy a healthy sexual relationship. Yeah, concern about pain and during sexual activity. This is a major element that could be involved, but it's worked through as a couple, or the sexual therapy helps in trying to help out in realizing that these areas can be dealt with if seeking professional help. There's another element that can come into the can fall into the place: less energy and desire for sex. Okay, so that's also can be because of the situation, but time for it, like we spoke earlier. The concern about whether they can have children or not, this is a major concern, but that comes later into the relationship, and it can and it is possible. The importance of motions, okay, especially if you're talking about disability and sexuality. Just as sexuality is an integral part of human life, so is love. Like everyone else, everyone looks for love. People want to be coupled up. People need the love. People need the intimacy. Every human wants to be loved and accepted. Whether one has a disability or not, it is important to express feelings. A partner of a person with disability should be aware of how important it is to express love or regard. Because even if the partner has no communication skills, then the relationship is going to be a complete failure. If not in a relationship, the most important thing is to remember that one is not defined by the disability. Okay, this is a lot of work that they have to self-work that they do. That the disability, they will find a partner usually, and you are a person that desires and loves like anyone else. And to have the right to do that. We spoke about the rights earlier. Practical matters. Okay, this is quite interesting. Okay, it takes energy to participate in and enjoy sex. So the disability may get in the way of a usual sex life. Okay, but factors that may limit in a decent sexual activity include pain. Pain, for example, especially chronic pain, can certainly make you feel less like sex. But if you can distract yourself with sexual pleasure, you may find it eases the pain. That usually is the case, by the way. Fatigue, we spoke about that earlier. Sex can feel like just another burden when fatigued or chronically fatigued. If there are times in the day when energy levels are better than others, consider engaging time. Then you have to make time. If you feel that you've got more energy, then that's when when it will be time to make a suitable time to have a sexual relationship. Also, this is a major element as well, mental state. If one is not feeling positive or suffering from anxiety or depression, we spoke about that earlier, one is unlikely to feel like having sex, and it can affect the sexual relationship or the relationship generally. Here, the sex therapist's role is important in helping ease these feelings and regain their sexual interest. Okay, they work through together. Medication, if necessary, it can affect your sexual interest through thoughts and moods. It is important to share the concerns with experts in the field. Okay, so if a relationship, in a relationship and dealing with issues around disability, the following tips can be held. Okay, this is where we need to feel important as professionals and sex therapists, is to communicate. Communication obviously sounds so simple, but not everyone is open to communication. I found that I'm working with a couple that one of the partners is disabled, and a lot of the work, most of the sessions are on communication, understanding one another. One needs to open discussing feelings and concerns, as is the best way to solve problems together. State the needs clearly, not only around intimacy, but intimacy is important to discuss it, because otherwise sex can be just put aside. Read up about the disability and the condition, and understand how it is possible to adjust to all the different situations and include sex. Seek help if necessary, because seeking help can also help strengthen the relationship. Keep an eye on each other, okay? Watch for depression. It's natural to feel sad, but depression is more than sadness, and to be addressed. It's quite amazing because when people have gone through all the emotions and the anger and everything that we spoke about earlier, and you see a couple that are so in tune with the disability and their sexual life, there's just a wonderful couple there that are just willing to work together and have a great life together. So when they've acknowledged their new normal, this can change the whole world. The couples need to acknowledge the new normal. If the disability is acquired, if from an accident or if it, sorry, I'll say that again. The couples need to acknowledge their new normal. Okay. For example, if the disability has been acquired from an accident or for somewhere else, then it's a huge adaptation process that the couple needs to do. But once they've done that, the new normal for you could be completely different, and both of them need to accept this new normal situation. Social life needs to be very important, because sometimes what happens is because of this, they feel that they alienate themselves from society, from friends, from family, and seeing friends staying socially connected can be a huge element to prevent depression and anger and all those issues that we spoke about earlier. Address the stress. For many issues, there may be monetary, financial issues, or new divisions of labor and family responsibilities can cause a lot of stress. Try to address these issues, okay, and help them to address it, and include the desire to include to be physically intimate as well. Kindness is an obvious one, but it's not very obvious when people are going through a lot of other things. But try to be kindness. Consider kindness as well. Okay, so right. Oh, okay. So there I am. How are you doing, everyone? Okay, we still got a bit of time. So I'd like to. Okay, let me just try and get the slide on. Go on to the model. Okay, so I'm not sure if you know the model, maybe you do, but I've adapted the model in terms of, it's called the Blizzard model, in terms of how sex therapists adapt special needs or cognitive disabilities, physical disabilities. This model is fantastic by Anon. He developed this, and it's called the Blizzard model. Okay, the Blizzard model involves PLISSIT, Blizzard. P is the permission. LI is limited information, SS is specific suggestions, and intensive therapy. Okay, it's basically a pyramid, as I'm going to show you now, but I'm going to go back to that. This is what it looks like, okay? It works from permission to limited information, suggested specific suggestions, and then you have the intensive therapy. It is impossible to jump. Well, there's another theory afterwards that you can go straight to intensive therapy, but we need to legitimize the talk, sexuality, called first of all, which is the permission element. So this model has 4 levels of increasing intervention and interaction related to what kind of and how much help is given to the client. The varying levels largely revolve around what the client is looking for and how comfortable they are in discussing sexuality and disability. This is important. This is the first element. The permission is how comfortable the clients are in discussing sexuality and disability. Obviously, by the way, we need to think about our own thoughts as well, about how we're feeling about it, because I remember when I first started studying this area of sexual therapy, we had to all check out how we're feeling about it. We had to do a sexual assessment workshop where we had to reassess our thoughts and process about how we feel about sexuality and sex and erotic acts and so on and so forth, which brings me to now ask you how you feel about that before we get into this model, okay? Because if you feel that you're very difficult and you cannot talk about it, and you don't feel comfortable about opening up the sexual element with your clients, then they're not going to be comfortable, which it seems to be obvious, but we need to check ourselves how we feel about speaking about sex. Not easy. All different situations as well. I mean, if you think about all those different positions, all the different aids that we were dealing with and so on and so forth, one needs to actually find out where we are and how we can be in a position where the client can feel 100% about talking about sexuality and disability. This is the area of permission, okay? There's your model. So when we're talking about permission, this involves giving the client permission to feel comfortable, when we spoke about that, about talking about the topic of sex. This level was created because many clients only require the permission to speak and voice their concerns about sexual issues in order to understand and move past them, often without needing the other levels of the models that you saw in the pyramid. The sex therapist, in acting in a receptive and non-judgmental listening partner, allows the client to discuss matters that would otherwise be too embarrassing to discuss. So that's what I was saying, is you need to check how comfortable you feel about it, because if you are comfortable, then the client is obviously going to feel very comfortable to speak about it, and that can be more effective in the therapy process. Permission. Okay, here's permission. The next stage. The first stage, still on permission, we're carrying on, sorry. Permission is giving permission giving is central to the model. By broaching the subject early in the professional relationship, one can convey your approachability, interest, and openness to discuss the topic. Identifying that some people have concerns about sexuality can also make the client feel more at ease with discussing their own issues. This is what we need to ask. Have you got any questions or concerns about sex, relationship, intimacy, or body images? This can really help to normalize discussing sexuality in your sessions. So I'm going to go back on those questions. How does one feel about it? Do you have any concerns about it? How does it affect your relationship? Do you ever discuss sex in your relationship? Have you discussed your feelings about sex with your partner? Then we move on to the limited information, okay, which is the second stage here. Limited information, when the client is supplied with limited and specific information on the topics of discussion. Because there is significant amount of information available, especially for people with disabilities, sex therapists learn what sexual topics the client wishes to discuss, so that information, organizations, and support groups for those specific subjects can be provided. This is what our job is, to provide the limited information and learn about it. Working with your comfort zone and sphere of confidence, you can give general information about sexual issues. Given information in the form of leaflets or directions to websites, etc., this information can prove useful in identifying concerns, but permission giving must take place to ensure the information given is relevant, as well as offering a catalyst for discussion. Okay, so we've done that. We've done the permission, the limited information. Okay, so now we're moving on to the specific suggestions. Can you see with the specific suggestion moving up to the top? This is where the sex therapist gives the client suggestions related to the specific situations and assignments to do in order to help the client fix the mental or health issue at hand. Okay, this is a very important element. You'll see there when we speak later about sensate focus. This is another issue that we can do about intimacy and touch and so on and so forth, how that can work. But this can include suggestions on how to deal with sex-related positions or information, or how to deal better, achieve sexual satisfaction by the client changing their sexual behavior. For example, sexual positions can be, this is a bit of sexual education, but it can be how to use your sexual aids, as we saw earlier, you know, talking about it freely and discussing it, and, you know, suggesting it to your clients as well. 1 second. Simple solutions. Here we continue with specific suggestions. Simple solutions specific to your knowledge and especially can be offered. These can include, okay, alternative body images. For example, lingerie, support garments, caps, plugs, painful intercourse. Here you can suggest lubricants, vaginal moisturizers, or alternative positions. Performance issues, treatment for erectile dysfunctions, reduced energy levels, set realistic expectations, alternative sensation, possibly due to surgery, but not rule out emotional fatigue, as this may lead to permanent disengagement. Okay, so when we've done that, I just want to go back quickly to which is the intense therapy. Okay, this is when basically the pleased model sees it goes in through stages. Okay, from allowing legitimization of sexuality to limited information to giving specific suggestions of how to have sex and enjoy it, and providing a healthy sexual relationship between the couples. But the sex therapist can help the client deal with deeper underlying issues and concerns being expressed surrounding the issues of sexuality and disability. This is where the major issue comes up, you know, the depression, the areas that we dealt with previously, the low self-esteem, the body images, all those things come up, and they need to be dealt with, as well as how to have a successful sex life. Intensive therapy is the most important, but now we can see how it flows, okay? If we're looking for permission, here is when you're with the client, it's permission to discuss, or give the client the permission to initiate sexual discussion, speak about it freely, feel comfortable about it. Limited information, sex therapists learn what topics the person with the disability wishes to discuss, so that information and support groups for these subjects can be provided. Here we are on the specific suggestions. Sex therapists need to give specific suggestions related to specific situations and assignments to do in order to help the client fix or heal the sexual problem. Intensive therapy. Provide intensive therapy. We spoke that previously. This is how you can see it flows. Okay, now there's an argument. I'm not going to go into this, but the other one says, okay, here's the last one. The extended explicit model, which means that permission can apply at all stages. It doesn't really have to go up the pyramidal flow in like we saw earlier. Okay, they can all focus together. It can go from specific suggestions. It can have permission. It doesn't really. This is the model that that was done after the Please It model. But I'm seeing that time is running out, and I really think it's important to focus on just very briefly on a model that is very useful and could be very useful to couples with disabilities, or one with ability and the other not. The sensate focus model. I assume that many of you are aware of this focus, of this model, but it's an intimacy model. If you look in the bibliography, I'll just, well, if you have time, I'll show you the bibliography that I use and all the books that I use. It is in, you'll see which ones you can look up on this area. But sensate's focus is about touching and being touched. It's two distinct activities. You can maximize the potential of sensate focus by beginning without preconceived notions of what you will experience, how it will feel, how much pleasure it will produce. In other words, begin with an open mind. That's important, so as not to color your experience and feelings. Sensate focus, touching, is a highly useful adjunct to sex therapy for professionals to address sexual desire as well as a spate of sexual distresses and dysfunctions. Sensate focus touching was developed by Masters and Johnsons on the basis of their research and experience. Okay, it's a mindful connection to the self and the partner. It's fabulous, actually. It really, really connects the partners together. Now, this is how it works. Okay, the first phase is the partners take turns. By the way, this can actually be done alone. I'll discuss that in a second. But if you're in a relationship, the first phase could be take turns touching, kissing, and stroking anywhere on your partner's body, or if you're on your own, but except the genitals and breasts. For partners, sensate focus, one touches one person for 10 over, and does that for 10 minutes afterwards. Avoid touch that leads to orgasm or intercourse at any stage until we get to the fourth stage. We're only in the first stage, by the way. Then the next stage, which is the next day or whenever they decide as a couple, you do the same thing, okay? Okay, can you hear me now? Okay, the second stage is same as phase one, except that genitals and breasts can be included, so it can be touched. And the third phase is partnered sensal focus only. Okay, I'm glad you can hear me now. So we're going through all the different stages, okay, of sensate focus and touch. Engage in mutual touching, kissing, and stroking of each other's bodies simultaneously. Start with phase one, touching, then progress to phase two, but avoid touching that leads to orgasm and intercourse. This is important. Do not lead to orgasm or intercourse. When you get to the final stage, which is the fourth stage, proceed through phases 1 to 3, then more into a position as if you're going to have intercourse or masturbate for solo sensate focus. Move and rub your bodies together or against each other, but avoid intercourse or touching that will lead to orgasm until having completed 1 or 2 of these sessions. For example, it's got to be a while before you finally get to the final phase 4. Okay, 1 second. In a structured hierarchy of touching experiences, clients learn to turn off their internal chatter. This is important. And tune into their body, managing their mind's negative messages, building comfort, and accumulating sexual tension. This is sensate focus, a simple but elegant, effective strategy. And it's important, I just want to go back on that you go through all the different stages, okay? 1, Stage 1 was touching, kissing, and stroking, not the genital or the breast area. Stage 2 is the same, and then you may touch be included. Partnered censored focus is the third stage, where touching, kissing, and stroking of each other's body simultaneously. And then when you get to the fourth stage, you can proceed to intercourse, but it is important to do that a few times until you reach orgasm. Okay. There is a sensate focus, a simple but elegant and effective strategy. It is helpful for identifying and managing blocks. This is a good one because it helps people deal with their own intimacy issues and blocks to sexual feelings and expression, especially with disabilities. Whether the challenges, okay, this is another thing. When you deal with sensus focus and disabilities, people with disabilities, whether the challenges are as a result of disabilities or illnesses, it may be more difficult to imply sensate focus. However, there's all four stages. However, these difficulties are often primarily associated with how the client thinks about sex. Okay, these are the barriers that we spoke about and you heard about earlier. While the most important goal of sensate focus with aging, chronically ill, or disabled couples is to minimize pain and maximize comfort and mobility. The next most important step is to provide education, counseling, and therapy, which is our job, that can challenge the thought process or the thought patterns and limit beliefs such as, oh, I'm disabled, my sex life is over, it is difficult, it's no good, I can't do it, I'm not normal. Sex is not pleasurable. We have to remember that sex is pleasurable because we are able, pleasure-able, keyword, pleasurable. Okay, so to summarize, I've got a few minutes left. The myth that disabled people have no sexual needs has certainly been dispelled. Having a physical disability doesn't change your sexuality or your desire to express it. Disability may affect ability to have a regular sex life. One may have to approach sexual activity differently, and questions and concerns may come up relating to physical or emotional health. Disability sexual aids are designed to improve sexual mobility while using the natural motion of your body. Those are the different aids that you saw today. Living with a disability does not mean you can't enjoy sex with your partner. Both the disabled and his or her partner learn to be open, honest, and it is possible to have sexual potential. Sexual potential is present. A mutually rewarding sexual relation can be obtained, developed, because sex is pleasurable. So, my friends, I think that the idea is to break the silence. Sexuality, sex therapy, and disability. Sexuality and disability do exist, the right to exist. And I think and I hope that you managed to, it was a lot to deal with, a lot to do with today. We had a few technical problems, but I hope you did gain something from this lecture, and I thank you all for listening. We have a couple of minutes left if you wish to ask any questions. But don't forget that this is such an important. Okay. Okay, wait, I'm just trying to read it. 1 second. Okay, the ability to have children. Yes, that is a question. Okay, this is a very major issue, but it doesn't necessarily affect it because most cases, a lot of people in wheelchairs do have children. Okay, I don't think it does affect the ability to raise children. That's a myth. They do need guidance and obviously help and things like that, but it can deal with it. Extreme obesity can be a disability. Okay. But I guess one can adapt, in terms of energy. We can, when one is more, yes, I agree. Both in physical and ability, extreme obesity can affect it, but that's the matter of timing. When they're more energetic, maybe that it can affect the sex life as well. Okay, physical touch. Basically, if we're talking about physical touch, the sensory areas are very important. Basically, one begins to discover. One can begin to discover, oh, sorry, I'm so sorry. There I am, hello. One can get to discover the different elements and touch, because basically if there's certain areas that don't do it for them and they can't feel it, this is why that actual sensate focus exercises is very good, because one discovers which areas do it for them, what it does, and it does strengthen communication as well. Okay. I'm going to leave you. If you do have any other questions, I do have an email. I think it is there. You're welcome to send any more questions. Thank you so much for listening. I hope you did enjoy it. I hope you gained something about it. It was a lot of fun for me to bring this over. And thank you very much. Don't know how you turn this off. Thank you.